Hello, and welcome to the Introducing the Competencies for Performance Improvement Professionals in Public Health webinar. My name is Kathleen Amos, and I am the Assistant Director for Academic Practice Linkages at the Public Health Foundation. And I am joined here today by Ron Bialik, the President of the Public Health Foundation. And we're excited to be sharing a new set of competencies, the competencies for performance improvement professionals in public health. So first of all, I wanted to thank all of you for joining us today for this webinar. And I also wanted to thank the Centers for Disease Control and Prevention, and in particular, the Center for State, Tribal, Local, and Territorial Support for their support, both financial and otherwise, throughout this project. So just before we get started, I wanted to go through a few housekeeping items for the webinar. On the slide here, you can see an image of the attendee control panel, and you should see something that looks very similar to this on the right-hand side of your own computer screen. And this is how you can interact with the webinar. So first, we wanted to let you know that all attendees in the webinar today are muted. You do have two options for audio for the webinar, either using your phone or your computer speakers. If you are using your phone, please choose the phone call option in your control panel and enter your audio PIN, also found in that audio portion of the panel. If you are using your computer speakers, please choose the computer audio option, and this will just help reduce any echoing or other audio problems that you might experience. Second, I wanted to draw your attention to the handouts panel in that control panel. So we have uploaded PDF versions of the competencies that we're going to be talking about today, as well as the presentation slides for today. So you can download either of those items from the handout section of that panel to follow along, jot down any notes, what have you, as we go through the webinar. Also, throughout the webinar, please submit your questions or comments for us via the questions box in your control panel. You may send in your questions at any time, and we will share and address them during the question and answer section later in the webinar. And finally, this webinar is being recorded, and the archive will be made available following the webinar to you and to others who were unable to join us today. So just to say a few words about the Public Health Foundation, where I work, to give you a little introduction, the Public Health Foundation is a national nonprofit organization based in Washington, D.C. that serves the public health workforce. Our mission is to improve public health and population health practice to support healthier communities. And we do this by providing resources and tools, training, and technical assistance for public health workers across the country. Our work is focused on organizational development and specifically in the areas of workforce development, quality improvement, and performance management. So we have put together just a few objectives to guide this presentation today. So first, our goal by the end of today's webinar is that you will be able to describe the competencies for performance improvement professionals in public health. You will also be able to explain how these competencies can be used and to describe how to access the competencies and related resources. To accomplish these objectives, we have structured the presentation into three main sections. So first, we're going to start with a little bit of introduction or background about performance improvement to set the context for our discussion today. Then we'd like to share the newly released competencies for performance improvement professionals in public health and talk about these competencies and how they were developed. And finally, we'll spend a few minutes talking about how the performance improvement competencies can be used, resources that are currently available to support performance improvement professionals in using the competencies, and ways to stay informed as additional resources are developed. So the competencies for performance improvement professionals in public health, or you'll also hear me call them the performance improvement competencies or the PI competencies, are designed for performance improvement professionals working in public health. So we wanted to begin with just a quick note about how we've been defining performance improvement professionals. Performance improvement professionals form an integral part of the public health workforce and play an instrumental role in the continuous improvement of individual, program, and organizational performance. The job responsibilities of performance improvement professionals may vary, but work that falls under performance improvement may include developing or implementing plans and activities in the areas of quality improvement, performance management, workforce development, accreditation readiness, or community health assessment and improvement planning. As you might imagine from the range of job responsibilities listed on the previous slide, performance improvement professionals may fill many different roles within their organization. And here we've just included some examples of the types of activities they might be engaged in. Performance improvement professionals may serve as accreditation coordinators. They may lead quality improvement teams or train others in quality improvement, and design and implement performance management systems, including leading efforts to develop measures and targets for such systems. Performance improvement professionals may also work to identify needs for developing skills and competencies within their organizations and lead the development of workforce development plans to address those needs. Performance improvement professionals may be involved in conducting community health assessments and developing community health improvement plans to address the needs identified, or in aligning the numerous plans that exist within an organization to help ensure smoother performance. What these roles all have in common is that performance improvement professionals are key to improving the performance of individuals, programs, and organizations. Much of the success of health departments and other organizations depends on the capability of their workforce. Investing in enhancing the skills and knowledge, the competencies, of the public health workforce can lead to higher functioning organizations and healthier communities. As many of you may know, for more than 15 years there has been a set of competencies, the Core Competencies for public health professionals, that describe foundational or cross-cutting skills for all professionals working in public health. With the performance improvement competencies, we set out to design a competency set that would describe skills specifically for performance improvement professionals working in public health. The performance improvement competencies are based on the Core Competencies for public health professionals and were developed to offer additional guidance in performance improvement for public health professionals. The performance improvement competencies can support workforce development efforts, such as helping to guide development of job descriptions and performance objectives for performance improvement professionals, training and academic curricula to build performance improvement skills and competencies, workforce development plans to ensure a skilled performance improvement workforce, and tools and other resources to support the activities and growth of performance improvement professionals. So I mentioned that the performance improvement competencies are built on the Core Competencies for public health professionals. So that means that these competencies expand upon performance improvement concepts that are present in the Core Competencies. So there are a variety of skills in the Core Competencies that are focused on performance improvement. And you can see some examples on the slide here related to developing community health assessments, making evidence-based decisions, using evaluation results, or developing strategies for continuous quality improvement. These all encompass elements of performance improvement for all public health professionals, regardless of their jobs. The performance improvement competencies are meant to be specific to the discipline of performance improvement and offer additional skills beyond the Core Competencies that are relevant for individuals who specialize in performance improvement. So for an example of how the performance improvement competencies expand on the Core Competencies, I mentioned there's a competency in the Core Competencies related to developing strategies for continuous quality improvement. The performance improvement competencies dig a little deeper into this concept and focus on coordinating development and implementation of an organization-wide quality improvement plan. So with that background about the competencies, how did this set of competencies come to be? The development process for the performance improvement competencies took place over several years, beginning with the development of a first draft of these competencies in early 2015. Development of this competency set since then has been informed by the guidance of the Performance Improvement Competencies subgroup of the Council on Linkages between Academia and Public Health Practices Core Competencies Work Group, which has more than 80 members from across the country. Input from national organizations, as well as from technical assistance providers and trainers who have worked with over 500 health departments on performance improvement activities. A comprehensive environmental scan that included a review of literature and resources related to competency development and performance improvement, and opportunities for performance improvement professionals to provide feedback about key knowledge, skills, and abilities for working in this area. And finally, feedback from performance improvement professionals on a draft version of the performance improvement competencies that was gathered during an open comment process earlier this year. All of this input together was used to refine and ultimately finalize version 1 of the performance improvement competencies in June. So with that, we'd like to introduce the newly released performance improvement competencies. So just as a quick reminder, that you can download a copy of these competencies from the handout section of your control panel if you'd like to look through them as we talk about them over the next few minutes. The competencies are also available from our website at the URLs you see on the screen here, www.phf.org/PI Competencies. Just a quick note about the functionality of the webinar. So the links that you see in the slides on your screen right now are not live, but if you do download the PDF copy of the slides from the handout section, all of those links are live, so you should be able to just click and go to the resources there. The performance improvement competencies contain 19 competencies focused on performance improvement skills and knowledge in the areas we mentioned earlier: quality improvement, performance management, workforce development, accreditation readiness, and community health assessment and improvement planning. Performance improvement related skills that are found in the core competencies are not repeated in the performance improvement competencies. So the performance improvement competencies are meant to be used along with the core competencies to support workforce development for performance improvement professionals. To help facilitate use with the core competencies, the performance improvement competencies are organized using the same domain structure and names used in the core competencies. There are not specific performance improvement competencies within every core competencies domain, so the performance improvement competencies are organized into 5 domains: analytical and assessment skills, policy development and program planning skills, community dimensions of practice skills, financial planning and management skills, and leadership and systems thinking skills. So I wanted to just take a minute here to look at some examples of some of these competencies. So I'm not going to go through the whole document. You can obviously look through the document yourself, but we did just pull out a few competencies to highlight the types of skills that are present in this competency set. So for example, in the performance improvement competencies, you will find skills such as demonstrating how data and information are used to improve individual program and organizational performance. So for example, selection and use of valid and reliable quantitative and qualitative data, data-driven decision-making, data management, and performance measurement all play in here. Describing how quality improvement, performance management, and workforce development are used to improve individual program and organizational performance. Applying quality improvement, performance management, and workforce development frameworks, methods, tools, and models to improve individual program and organizational performance. Aligning quality improvement plans and performance management systems with other organizational and community plans. So for example, strategic plans, community health improvement plans, workforce development plans, communication plans, or all hazards emergency operations plans. Using input of and feedback from internal and external customers in developing, implementing, and evaluating quality improvement, performance management, and workforce development activities. Building teams from all levels of the organization to improve program and organizational performance. And advocating for the use of quality improvement, performance management, and workforce development methods, tools, and practices throughout the organization. So for example, activities including creating organizational buy-in, overcoming resistance, communicating value, developing a culture of quality, supporting a culture of learning, and encouraging innovation. So even just from these few examples, I hope you can see some themes and where the emphasis lies, particularly on quality improvement, performance management, and workforce development, as well as on supporting individual program and organizational performance. So now that we've talked a little bit about what the skills are in the performance improvement competencies, how does building these skills help public health professionals and organizations? What kind of impact might having stronger competencies in performance improvement have? Building performance improvement skills and competencies can help individuals and organizations better identify and meet the health needs in their communities. It may lead to increased capacity to identify pressing health needs and can help improve the ability to conduct assessments, develop new partnerships, and improve existing partnerships. These skills can also help support identifying and monitoring key metrics to gauge organizational improvement and improvement in health outcomes, and can help meet the requirements of the Public Health Accreditation Board for Health Department accreditation. So I mentioned earlier that the performance improvement competencies are meant to support workforce development efforts, such as helping to guide development of job descriptions and performance objectives for performance improvement professionals, or training and workforce development plans to build performance improvement skills and competencies. In terms of job descriptions, the performance improvement competencies can be used to identify skills relevant for a performance improvement position. Since the performance improvement competencies, as I mentioned, are designed to be used with the core competencies, and there are skills relevant for performance improvement in the core competencies that are not repeated in the performance improvement competencies, when developing a job description for a performance improvement professional, you may wish to pull competencies from both the core competencies to describe general or foundational type skills, as well as competencies from the performance improvement competencies to describe more discipline-specific performance improvement specific skills. So to help with this process, a supplemental resource was created. And what this resource does is list the performance improvement competencies along with the competencies from the core competencies that may be especially relevant for performance improvement professionals in each of the 8 core competencies domains. So you can see on the screen here just a screenshot of the cover of that resource. And then these are a couple screenshots of what the content of the resource looks like. So as you can see, we have lists of each of the core competencies domains that present competencies from both the performance improvement competencies and the core competencies within each of those domains. You'll recall there are not performance improvement competencies within all of the domains. So you can see sort of the 2 different types of examples here. So the first one in the back is analytical and assessment skills. And this is an area where we do have competencies specific to performance improvement that you can find in the performance improvement competencies, as well as more general competencies within the core competencies that might be relevant for performance improvement. The screenshot in the front focuses on the communication domain, and this is sort of the opposite example where there are not specific performance improvement competencies that fall within this domain, but there are a number of competencies within the core competencies that might be relevant skills for performance improvement professionals. So when you're working on putting together a job description, communication skills are an area where the types of skills you may wish to include for your performance improvement professionals are found in the general skills of the core competencies. So again, you can find this supplemental resource on our website. The link is at the bottom of the screen here. It's just www.phf.org/PI Core Competencies Alignment. So we also talked about training and workforce development plans. And once you have identified competencies that are relevant for your job and areas in which you would like to build some additional skills, you might look for training in those areas as one way to help build those skills. One great resource for locating training is the Train Learning Network, the largest learning network designed specifically for public health. So you all have access to Train for free. So if you don't yet have an account, please feel free to sign up. Simply visit www.train.org to get started. The Train Learning Network has a wealth of courses, many of which are relevant for the various areas identified in the performance improvement competencies. Train currently serves over 1.75 million learners from public health, healthcare, behavioral health, preparedness, and other health fields, with thousands of quality courses from 3,000 course providers. As just one example of how Train can help in locating courses related to the skills described in the performance improvement competencies, we've included a link to courses relevant to the first of the performance improvement competencies, demonstrating how data and information are used to improve individual program and organizational performance. And again, the link on the slide is not live, but if you download the version in the handout section, you should be able to just click that and it should take you right to Train. So that's just one example of a tailored search that can be created with the Train Learning Network. And over the coming months, we will be developing additional tailored searches for Train related to the performance improvement competencies. These searches will be pre-formulated for you to identify courses that apply to concepts present in the performance improvement competencies, so that at the click of a button, you'll be able to pull up a list of courses in that area. In the meantime, in addition to visiting Train directly at train.org to explore the courses available, we invite you to visit our website at www.phf.org/train to learn more about the Train Learning Network and how you can use it to meet your organization's workforce development needs. We also invite you to stay connected with activities surrounding the performance improvement competencies as we move into developing these trained searches, and be informed when these or other resources are available. So first, the performance improvement competencies are easily available to download from our website at www.phf.org/PI Competencies. You can also find additional information there about the performance improvement competencies and links to other available resources. If you don't want to check back to our website, over and over again, waiting for that latest resource to arrive, we do have a couple of newsletters that regularly contain information about the performance improvement competencies. So we share information through both PHS eNews and the Council on Linkages update. And if you're not already subscribed to either of those, you can sign up through the links on the slide. And we've also included the link to sign up for other PHS newsletters here if you're interested. If you would like to get more actively engaged in work related to the performance improvement competencies, we'd welcome your participation in the performance improvement competencies subgroup that I mentioned earlier, which provides guidance for this effort. Just let me know if you're interested in that group, and I'd be happy to add you. And finally, we are always open to your questions and feedback about the performance improvement competencies. We do provide technical assistance by email and phone. So please let us know anytime if you have questions as you are using the performance improvement competencies. And please also let us know what you think as you start to use the performance improvement competencies. We'd love to hear any ideas you have for tools that would make implementation easier, how the competencies are working for you, how you're using them, really anything. So please feel free to email me at any time. So with that, we deliberately tried to leave a lot of time in this webinar for questions because we really do want to hear what will be useful to you as you start using the performance improvement competencies. So I'd like to open the floor now for questions. As a reminder, if you have a question or a comment, please type that in the questions box. We are joined in the room here by Russ Rubin, who's our Director of Strategic Communications, and he'll be going through all of those questions and reading them aloud for us, and Ron and I are happy to do our best to try to answer them.
All right.
Russ, do we have any questions to start off?
Thank you, Kathleen. Here's a hybrid question, a common ask from our audience today, and that is, what do PI professionals need to help build their skills and competence, and what gets in the way?
Well, this is Ron. One thing that I'd say that PI professionals need is time that's provided during work time to be able to take some of the training and to practice some of the skills. So one of the things that often occurs is people do participate in training, have access to training, and don't always have the opportunity then to practice it back at work. So it's key for the organizations in which people work to be supportive of what it is that performance improvement professionals are doing so that those skills can be developed, practiced, used, and ultimately used in the workforce to improve the organization.
Mm-hmm. And I would also like to toss that question out to the audience. We have a ton of performance improvement professionals on the webinar today, and we would love to hear from you what would be helpful as you go about implementing these competencies. We've done a lot of work, particularly with the core competencies for public health professionals, to develop resources and tools and training and provide technical assistance to help build skills. Things like examples of collecting examples of job descriptions or workforce development plans, putting together examples of how organizations are using competencies. So please feel free to share your suggestions with us if there are things that you think would be helpful as you go about implementing the performance improvement competencies. We'd love to know that and be able to help you move those efforts forward.
Here's a fun one, and feel free to keep sending in your questions in the questions box in your control panel. And I'll get to as many of your questions as I can. The fun one is, what are common job titles for performance improvement professionals? I have heard, I've seen comments from our audience that says, you know, I'm a community health planner, or I'm a performance management coordinator, but I'm a performance improvement professional. What do you see out there as the most common job title?
Most common? I don't know about most common. I think there's, as you might have guessed, and Russ just alluded to in reading the question, like, this area encompasses such a wide variety of activities within health departments and other types of organizations. And so I think you have a huge variety of job titles, accreditation coordinator, performance improvement manager, job titles related to QI, workforce development, performance management, data and analysis, community health improvement. I don't know, Ron, do you have other suggestions? Well, that is a fun question.
Yeah, we could go on with hundreds, I think, at this point. But the ones that you hit on, Kathleen, are the more common, I'd say, the accreditation coordinator and performance improvement manager in particular.
Here's one. What exactly does the performance improvement competencies subgroup do in case someone is interested in joining?
Great question. So the performance improvement competencies subgroup was set up to help guide and provide input to shape the performance improvement competencies. So they were involved in a lot of the work that I mentioned earlier when I talked about development of the the performance improvement competencies. We have two groups, the core competencies work group and a performance improvement competencies subgroup. So they were involved in the environmental scan and providing feedback on initial drafts of the performance improvement competencies. Because what we really want is a sense of what's going to work, what's going to reflect reality for people who are working in performance improvement. Now, as the competencies, the first version, at least, of the competencies have been completed, the group will be moving into helping them with dissemination of the competencies, helping to build that awareness, and increase knowledge about the competencies, as well as potentially looking at developing resources and tools that can support people who are using the performance improvement competencies. And if you are interested, feel free to just send me an email, and I'm happy to talk more about that with you.
Speaking of attendees looking for some extra credit here, do you recommend any certifications like PMP, Six Sigma belts, or Lean that a performance improvement professional should try and obtain?
I'm thinking about the question. I'm thinking about the answer. In some ways, it depends upon the organization where you are practicing or where you intend to practice as far as the type of certification. One of the downsides of some of the certifications are that they really focus on particular methods and processes, and what can happen with some of those certifications is you go into an organization and you try to fit what the organization is going through to the particular certification that you have. And in reality, for quality improvement, performance management, workforce development to really work in an organization, it has to fit with the organization's culture, the organization's experience, et cetera. So I'd say the certifications can be valuable for digging deeper, but also be a little cautious about how you apply what it is you learn, because you have to be sensitive to the organization's structure, culture, et cetera.
Here's a good question about measurement. How does one measure whether improvements in these competencies are being made? Is there a metric that describes examples of what abilities within the competency might be demonstrated to show mastery?
The age-old question.
Yeah, that's an age-old. We received the same question with the core competencies, and some of our colleagues in academic institutions have thought about it and have developed some methods for doing that. For the performance improvement competencies, in reality, at this point, we really do not have metrics for those. It is something that the subgroup at some point in time could turn its attention to, but it is really, 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 really difficult. Kathleen, I don't know if you want to add.
Sure. I mean, I think I agree that it's really, really difficult, and I'm not sure we've found the perfect solution yet. With the core competencies, we have kind of basic self-assessment type things of being able to say whether you feel you've made improvements in certain areas, but that certainly doesn't get as far as you're asking the question. I think I don't know if this is ideal, but one of the ideas that has been floated and I think would be really interesting is sort of kind of scenario-based assessments where rather than just asking, are you good at this, yes or no, it's developing a scenario in which you would have to apply the skills to be able to show that you've mastered them. I have yet to see anything like that, I think, competency-wise in our area. I think a number of groups have tried it. It's really hard to do. So it's a great question.
Mm-hmm.
Here's one about change management. Everything we do in process improvement involves a change at some level. Is there some guidance on the competencies related to change management?
There is some training related to change management. There are some books on change management. The competencies themselves, Kathleen, I don't recall if there's specific.
Not within the performance improvement competencies, I don't believe, because they're covered in, change management is included in the core competencies. So this is one of those areas where a topic or a competency, a skill, piece of knowledge, what have you, is sort of relevant across the board. It was felt that change management, as you pointed out, applies to everything performance improvement, but also applies sort of throughout public health. And so that concept is present in the core competencies and was not repeated specifically in the performance improvement competencies. But I believe when we looked at the core competencies to pull out relevant performance improvement competencies, that was one of the ones that was highlighted.
Yeah.
Here's one related to Train. Are there performance improvement courses available on train.org, or do you have any suggestions?
Yes, there are a number of performance improvement oriented types of trainings. I think the link that Kathleen put up there to the one competency demonstrates how data and information are used to improve individual program and organizational performance. If you were to click on that hyperlink from the slide set, that would take you to a live search of Train that we've developed the search criteria behind that for that hyperlink, and that will bring up that set of courses. But you can look for do keyword searches like quality improvement, performance management is another one. If you do workforce development, you might end up with a very large number. So you can do a variety of searches, but what we intend to do is develop some more pre-formulated searches, which brings me to a question for all of you, and that is, we've developed one search thus far. What priorities might you have? What do you think is really important in terms of the competencies? So there are now 19 competencies in performance improvement. If you had your druthers, and if you could get a search that would put up, 5, 10, 15 courses, which competencies would you want that for? So please chime in over, the next couple of minutes, and Russ will return back to that after you get a few responses.
Thank you. The questions are really pouring in now. What are your thoughts on how to integrate these competencies into schools of public health curriculum?
That's an exciting one. If you've looked at the more recent accreditation criteria for schools of public health, the CEIF criteria, they are much more practice-oriented. And the schools are really paying more attention, schools and programs are paying more attention to this. The Association of Schools and Programs of Public Health is an active participant and member of the Council on Linkages, and actually their executive director will be joining us on a panel at APHA just in a couple of days, next week, to be talking about what ASPPH and its members have been doing to help implement activities of the Council on Linkages or priorities of the Council on Linkages, and they're addressing one of the things in particular are the work towards competencies. I don't know, Kathleen, do you have something more specific? No.
I don't know. I think it's a good, I agree that it's an exciting area, and the use of competencies in general to shape education and training helps ensure that there's that connection between academia and the practice environment. So we want to ensure that we're building skills, obviously, within graduates that will make them effective working in public health departments and other public health organizations so they can hit the ground running. And obviously you won't learn everything, much as we found with the core competencies for public health professionals. I'm sure with the performance improvement competencies, you will learn all of that in school. There will be a balance between what can be taught well in an academic environment and what requires more hands-on work experience. But I think it's nice to think about how those things can shape and bring connection, so that that there is a bridge or a connection between the professional academic environment and then moving into continuing education and how we ensure continuing training for people in the workforce.
I just want to add one other piece to that, Kathleen.
Sure.
And that's the academic health department. So that's where, the academic institution and the health department have a more formal collaborative relationship. And I think through the AHD type of relationship is another way where you can work towards building performance improvement competencies. And when I say, well, it's really both institutions in reality. I think the academic institutions can learn a lot from our health department colleagues as well, because you're in the field, you're doing the work, and you're learning. And over the past 10 years, there's been a lot more movement towards quality improvement, performance management, workforce development. And so I think it's a nice relationship where both the academic community and the practice community can be learning together and sharing together on this one.
Here's one for folks, I think, trying to project out to see if they're the only ones thinking of this question, which is, what are the greatest weaknesses, needs, and gaps to build skills and competencies in the field?
Money and time.
That's pretty straightforward. Just solve that one.
I mean, there's, we've heard this from many accreditation coordinators. It's a tough job. It's a tough job to coordinate accreditation activities within an organization, and the individuals who are doing that need to have the support of leadership within the organization, and usually do get that support. But one cannot underestimate the time it does take. And when you do underestimate it, then that does not necessarily lead to the outcome you desire. The activities of performance improvement professionals increasingly are demonstrating tremendous value to organizations, because organizations are improving what they do, becoming more efficient and effective in what they do, and are demonstrating that accountability to their communities as well.
A lot of compliments coming in for the two of you, and some feedback for Ron, the question that you put out about what would you like to see, some customized trained searches. Don't worry, I wrote them down for you. But just so everybody knows, joining us today, some of the common topics that came up: evaluation, facilitation skills, alignment of plans, change management, policy development, financial planning, teamwork, community engagement, customer service, and QI, and many others. Thanks for your feedback from our audience, and those are great ideas. Did want to move on to some more questions about what do you see as the greatest gaps in terms of building performance improvement skills and competencies? Which of the skills and competencies should be priorities?
You're asking us? I
think that's another place that we really are looking for your input. In developing the performance improvement competencies, there was a whole process of sorting through a variety of different skills and knowledge and what's covered what's specific to performance improvement, what's covered elsewhere, what needs to be included. So there was definitely prioritization done to get us to the 19, but I think hearing from people as you are, reflecting on what you do in your jobs, do these line up? What areas are most relevant? And part of the, I don't want to say problem, it's not a problem, but part of the thing with the performance improvement competencies is that performance improvement is so broad that, if you're a director of QI, your job might look very different from a director of workforce development or someone who's leading accreditation or someone who's focused more on developing community health improvement plan. And so I think there will be different priorities for different types of jobs that fall under that umbrella of performance improvement. But we would really like to hear from any of you if there are areas, as Ron said, areas to focus on first, areas that, we're going to be building searches, we're going to be looking for training, trying to pull that together for people. Are there areas where training would be more helpful quickly? Like all of that kind of stuff. I think we're open to any of that sort of feedback.
And, I am going to add one other comment to that. Sometimes what we've observed in the field, so we do a lot of work in the field with health departments. We do on-site technical assistance and training, and over the past 6 years or so, we've been out there and done work with about 500 different health departments. In that work, what we have seen is often there's quality improvement. That's one categorical program. There's performance management. That's one categorical program. There's workforce development. That's one categorical program. And so one of the things I'd say is when you look at the performance improvement competencies, you'll see that a number of them have quality improvement, performance management, workforce development, all in the same competency. And that's by design, because in reality, the quality improvement activities, the performance management activities, the workforce development activities should be working in concert. They should be aligned. And that's something we also are seeing increasingly in the field as we're out there, is that health departments are now moving to greater alignment. But we still have a long way to go with all of that.
Any thoughts on how performance improvement professionals can identify and prioritize the most useful measures that are translated into action?
Identify and prioritize. Can you read that one more time?
Any thoughts on how performance improvement professionals can identify and prioritize the most useful measures that are most translated into action?
Is there a QI tool for that?
I was thinking there are quality improvement priority organizational tools.
Right. There is the prioritization matrix that is a quality improvement tool. And Russ, I'm not sure if that one's up on our website.
I will put it in the chat box if I can.
We do have. There is a prioritization tool. This again goes back to our work with the core competencies, but there are a couple of prioritization tools with the core competencies that I would think in theory could be adapted. So the prioritization matrix that Ron just mentioned is built into part of a 3-step competency prioritization tool that was designed for use with the core competencies. Doesn't mean it couldn't be used just as well with another competency set. So that might be one to look at.
Absolutely, yeah.
I don't know the link off the top of my head, but we can follow up. We have contact information through the chat box as well, so we could follow up on that with the actual link to that tool. Okay,
just a few minutes left. If you have a burning question, send it in now so we have time to get to it before we sign off today. Next question is, does there exist or will there be an associated skills assessment questionnaire for public health staff, not just for performance improvement competencies, but maybe also for the core competencies?
So there is, I kind of alluded to this in one of my answers, I guess, earlier. There exists currently a self-assessment instrument related to the core competencies. That is pretty straightforward. It is self-assessment like we talked about, so it's very hard to know what you don't know. But it's a pretty straightforward numerical assessment where you rate yourself on a scale from essentially having no knowledge of the competency to being fully competent and able to teach it to others. And it's self scores, I guess, and it gives you a score in each of the domains so you can see what areas you're stronger or you perceive yourself to be stronger and what areas you might want to look to build more skills in. So that does exist on our website now related to the core competencies, and we are in a process of building an additional assessment tool, similar kind of structure, but using a modified version of the core competencies. So the core competencies itself, as many of you probably know, are organized into 3 tiers. And within each tier, there's roughly 85 to 95 competencies. The modified version of the core competencies that we're building the assessment on now assesses on approximately 55 competency areas. We do not currently have an assessment, a similar type of assessment related to the performance improvement competencies, but we're happy to just put that on the list of future wishes and desires as we look to think about what resources could help support this area. I don't know if that really answers the question or not, but if it doesn't, feel free to type something else in the chat box and I'll follow up.
And here's a question that I know you both will love. Any advice for students who are about to enter public health and are looking to kickstart a career in performance improvement?
That's a good question.
Wow. I mean, one is to be sure that you do an internship with a health department, because health departments are typically always looking for ways to supplement what they do and improve performance in what they do. So I think an internship experience is a great way to do that.
How can the performance improvement competencies be used to enhance performance improvement team members' competency and skills?
Well, I think thinking about what the performance improvement competencies do is identify some skills and knowledge that should be useful for working in performance improvement. So I think to the extent of thinking through that competency set in relation to what skills or what knowledge you might already have present in your team, and then thinking about areas that you might want some additional support or some additional training or whatnot, and then build from there. So you kind of, I don't know if I'd advocate a full-scale assessment, but sort of a mini assessment or a qualitative assessment of what areas you think might be useful to build more skills in, and then to look for resources that can help meet needs in those particular areas. So rather than just kind of across the board looking for something that meets all of the competencies, you might prioritize essentially first. We've been talking a lot about prioritizing, and then look to train, for example, for courses that could help build those skills. You can develop within Train, you can, Train accounts are free for learners, so you could identify a series of courses and recommend them to people and have them take them. In theory, training plans can be built that help address skills. I don't know, Ron, if you have other thoughts to add to that.
Yeah, it was an interesting question. The thought that came to mind is, there are only 19 competencies specific to performance improvement. And if you have a QI team or performance improvement team, you could actually sit down with the 19 and say, as a team, what do we have? And also, what is priority? What is important? So for what you're embarking upon, all 19 may not be equally important. So you can identify what really is important to your team. And then if you say, you know what, we are missing somebody who really knows how to use and manipulate data or analyze data. Manipulate probably is not a good term to use. Who knows how to use and analyze data. So we should bring somebody else into the team to help us do that. So that's another way I think you could use the competencies with the team.
We were talking about schools of public health earlier, and here's another one for academia. Are our public health academic programs starting to develop courses that address these new competencies?
I don't think in a large degree at this juncture. It's been a little bit slow, in all honesty, when I've looked at curricula for our academic institutions in terms of, again, quality improvement and performance management in the schools and programs of public health. There's some, but there really hasn't been a lot, and that may be in part because those types of skills maybe are more appropriately taught within a practice environment. And I say that because with quality improvement and performance management, if you go through didactic training on those, by the time you get to your health department, you may not know how to use it. Because if you don't use it, you lose it pretty quickly with performance management and quality improvement. So it is something where I think our academic colleagues are looking a little bit more at what they can do in that area. But again, I think it's something that health departments need to be encouraging, and other organizations need to be encouraging being developed within the practice world.
And I think specific to, so the performance improvement competencies are obviously really new in the grand scheme of things. They were finalized this summer, were released in June, so I would doubt that any academic program is using that specific competency set that quickly, that heavily, but we do know that over time, having these connections is helpful. So with the core competencies, for example, many academic programs use the core competencies to design their courses, to design their curriculum. We see in the most recent surveys, which are a couple years old now, we see about 90% of academic programs, public health related programs, using the core competencies, and then that translates, again, on the practice side into a heavy use among health departments. So about 80% of state health departments using them for workforce development, about 45% of local health departments. So there is precedent for that kind of coordination of academia and practice related to competency-based education and training, and hopefully over time, as we obviously, the performance improvement competencies are available now, but as we continue to build momentum behind that competency set, it would be nice to see courses and trainings and whatnot developed with that particular set of competencies in mind also.
I just want to thank our audience for all the thoughts, the suggestions, the engagements, sharing your experiences through the chat box. To the extent that we can aggregate all your information and share your suggestions, your resources. Some are suggesting train courses. To the extent that we can share that with the whole community when we post the archive of this webinar, we will certainly do that. But I'll throw it over to Kathleen to bring us home.
Yeah, so Russ mentioned the archive of the webinar. I mentioned at the beginning that will be available in the coming weeks as we process everything. And I agree with Russ. Like we've had so many great comments and questions in the chat box. To the extent that we can pull that information and share it, we will certainly do so, and we'll create links from that archive page. We'll also be sure to email the archive to all of you when we have all of that stuff pulled together and available. So I just wanted to close here with a few upcoming events and some resources that you might be interested in or that might be helpful. First, if you will be at the American Public Health Association annual meeting next week in San Diego, so we're all getting ready to head to APHA, we'd love to connect with you in person at any one of our sessions or at our exhibit booth. So we will be hosting, along with the Council on Linkages between Academia and Public Health Practice, so the group that's responsible for the core competencies for public health professionals, a session on Monday morning called Collaborating for Action, Implementing the Council on Linkages National Workforce Development Strategy. So we will be joined for this interactive panel session by Bill Keck, who chairs the Council on Linkages, as well as Jose Montero, who's the director for the Center for State, Tribal, Local, and Territorial Support at CDC, Mike Frazier, who's the CEO of the Association of State and Territorial Health Officials, Lori Tremble-Freeman, the CEO of the National Association of County and City Health Officials, and Laura Magana, who's the president and CEO of the Association of Schools and Programs of Public Health. So we should have a good representation there, and Ron will be serving on that panel as well. And the panel's list will all be asked to discuss actions the Council on Linkages and its members are taking to support workforce development and successes that are being achieved through coordinated action. So that should hopefully be a lively discussion. In addition, on Tuesday, we will have 3 competencies presentations, including a live version similar to the presentation you heard today. So if you have friends going to APHA who you want to learn more about this, they can feel free to join us for that. So that will be in the morning during building a skilled performance improvement workforce within public health. In the early afternoon, we'll be presenting on using the core competencies for workforce development, and then later in the afternoon on the development of a new set of competencies, even newer than the performance improvement competencies, which are designed to support population health. So lots of great competency content these days. We'll also have print copies of all of these competency sets at the Public Health Foundation's booth, which is number 2027 in the Public Health Expo. And myself and Russ and Ron and other PHF staff will be available at the booth to answer questions. So again, live links in your handouts, PDF of the slides. The APHA annual meeting link should take you to more information about these sessions and other PHF activities at the meeting. Following the APHA annual meeting on November 29th, the Council on Linkages will host its last meeting of the year. Council on Linkages meetings are held virtually and are always open to the public, so you're welcome to join us for that. If you are interested in hearing the latest updates on the academic health department learning community, the core competencies, performance improvement competencies, and population health competencies, or in discussing the future directions and priorities for the Council on Linkages as we move into 2019, please mark your calendar for 2 p.m. Eastern Time on the 29th. And again, to register for the meeting, you can simply follow the Council on Linkages meeting link that's on the slide. And finally, the Public Health Foundation offers a variety of resources, including tools, training, and technical assistance to support performance improvement efforts. We've included links to a handful on this slide. So in addition to the performance improvement competencies and the core competencies, PHF has a number of other performance improvement tools and resources, including the Public Health Improvement Resource Center, which contains more than 600 resources from a variety of organizations on performance improvement topics, and the Public Health Quality Improvement Encyclopedia, which details 75 QI tools and is supplemented by additional tools online. As mentioned earlier, the Train Learning Network, the largest learning network for public health professionals, provides access to courses and training plans in a wealth of topic areas. And PHF also offers on-site training and technical assistance in a variety of performance improvement areas, particularly focused on quality improvement, performance management, and workforce development. So please do explore our website and let me know if you have any questions or if I can help you find anything. My contact information is on a number of these slides, but right here at the bottom. Thank you very much once again for joining us for the webinar today, and I hope you enjoy the rest of your afternoon. Thank you.